Hello, my name is Yasmin Villagran, and I will be presenting a presentation that talks about child abuse and neglect. What is child abuse and neglect? Child abuse and neglect is the failure to care for a child, whether that is parent or caregiver, that puts the child in any kind of danger, whether that is sexually abusing the child, exploiting the child, or causing any form of physical or emotional harm to the child. So, Christoph and his contributors in an article stated risk for children maltreatment is known to be higher in the first years of life compared to older children and youth. According to Cohen, neglect also may count when the caregivers leave their children at home alone, don't take them to school, or don't get them medical assistance when needed, or when they do not provide them with personal hygiene or give them the basic needs such as food. So if parents can afford to buy nutrition, shelter, clothes, or medical care, parents can lose access to their children even though they are trying their best to care for them, especially if they are unemployed or experience any type of household disruption. So these are some social structures that don't allow the children to get the resources needed despite their parents trying their best. So child abuse and neglect within young Chinese mothers. So, some reasons for children maltreatment and neglect in Chinese young mothers include social stigma, poverty, and Chinese culture. So, parents' characteristics and parent-child interactions have larger effect sizes for child neglect, whereas parents' characteristics and family relations have larger effects on children's physical abuse. So, young pregnancies is associated with poor outcomes in children, such as preterm delivery, lower birth weight, and cognitive delay. This causes frustration within the young mothers because taking care of a child who requires additional care and medical attention can be seen as problematic to them, which may elevate the risk of child maltreatment. Also, when essential interaction between the young mothers and the children becomes dysfunctional, the mother's risk of using multiple forms of child maltreatment increases. So, social stigma with young Chinese mothers. Social stigma adds to young mothers, adds strain to young mothers, and they avoid to seek medical help because they don't want to be judged. So daily parent child interaction could be very stressful for young mothers if they are challenged by parenting difficulties and lack social support. This is true if they are reluctant to seeking help when in need because of the fear of social stigma attached to teenagers and young mothers in Chinese society. Also, social stigma may barricade young mothers from seeking help and social services when in need. Due to social norms that disapprove teenage pregnancies in Chinese society, Chinese mothers who feel shameful may avoid seeking social and public support when in need. Social stigma may also add strain to the life of teenage mothers living in poverty and thereby eventually creating higher risks for physical assault or neglect to their children. So, poverty with young Chinese mothers. This is poverty causes stress, and low education means that they don't have a job with a good income. So, young mothers are likely to have lower educational opportunities, and they also lack social support. They use substances and have repeated pregnancies, so pregnancies back to back. These conditions may compromise the quality of care they provide for their children, and hence why it can increase the risk of maltreatment caused to their children. Family backgrounds such as poverty and single parenthood are related to lower socioeconomic statuses of young mothers and go in hand with child maltreatment. Those in poor families, especially with parents who have low levels of education or who are single, most of the instability causes stress and resource deprivation that poor parents experience. So, poor family background, including living in poverty and being sing single or divorced, was a standalone significant domain associated with risk of perpetration of either physical assault or neglect with young children. So there's Chinese culture with young mothers also affect and contribute to child abuse and neglect. So Chinese culture disapproves teenage mothers. Chinese culture values family honor, and they believe that premarital sex is immortal and ruins young women's lives. So, Chinese culture is strongly influenced by Confucian ideologies that regard premarital sex as immortal, and they ruin the future of women. This is culturally disapproved to have babies at such a young age. Chinese culture values protection of faith and family honor. So, young women may face fear from seeking help from the family during their pregnancy, so they bear greater stress in parenting. So, factors that contribute to child abuse. Some of them include intimate partner violence, which correlates to child abuse. Um, there's still factors that affect the chances of child abuse, and there is proximal factors that affect the chances of child abuse. So, Christoph and contributors said that child exposure to intimate partner violence evidences high rates of co-occurrence with physical abuse and neglect. Exposure to intimate partner violence is associated with child abuse as well as an accumulation of adversities. So, distal factors are assumed to operate as long-term conditions, which are not necessarily casual to child abuse or neglect, but affect the likelihood of of it to occur. Some things include low income, low educational resources, as well as difficult family conditions have been shown to increase the risk of child maltreatment. Some proximal factors like poor parental mental health are more imminent prevalence for family interaction and therefore often serve as a target of preventive interactions. Participation in preservation programs as well as counseling was shown to be associated with child maltreatment reoccurrence after prior incidents among families with children aged birth to 4. Risk factors of child abuse and neglect are unplanned pregnancies, child adjustment difficulties, negative attributions of child behavior, marital depression, and social isolation. So, child exposure to intimate partner violence reflects negative parental emotionality. And here we have child neglect factors, which include poor quality of supervision, history of mental health problems, and poverty. So, Tim and contributors in an article stated that child neglect is a heterogeneous construct covering dissimilar negative child experiences such as poor quality of supervision, inadequate or insufficient availability of food, lack of school attention, and lack of required medical attention. Some examples of neglect are physical neglect, emotional neglect, mental health neglect, medical neglect, educational neglect, cognitive neglect, psychological and environmental neglect, lack of supervision, and denial of professional care and treatment. So there has been debates by scholars whether neglect should only indicate actual harm or also potential harm. So Tim mentioned that discussions whether neglect should be seen as not meeting a child's basic needs from the child's perspective, or whether neglect should be seen as parental commission in care. Also, non-Caucasian children have an increased risk for child neglect. Children raised by parents who experience abuse and or neglect in their own childhood are at risk for being a victim of child neglect. Some parents and family related risk factors are current mental health problems, psychiatric problems, having a history of mental or psychiatric problems, having a history of childhood abuse, age factors, being a single parent, low family SES, a large family size, and problematic family behavior. Some effects of child neglect of mothers related risk factors may be slightly larger than the effects of father related risk factors. This is due to the fact that mothers are more emotionally and physically involved with their children than fathers are. So, according to Cohen, Black parents say racism affects decisions of child welfare authorities, and when children are removed from their parents and placed in foster care, it is said that poverty is the reason why their children or child was neglected. So, questions to think about. What was a common factor that relates to child abuse and neglect? And did you learn anything new that you didn't before while watching this presentation? And these are my works cited. And thank you for watching my presentation on child abuse and neglect.